Assalamualaikum warahmatullahi wabarakatuh. Hello ladies and gentlemen, let me introduce myself first. My name is Raihan F. I'm a nursing student of Poltekkes Kemenkes Semarang. As you can see on the screen, our topic is about nursing ethics. My topic is very important for you actually for nursing student because the application of ethical values in providing nursing care will be reflected in every step behavior and in responding to the situation we face. Of course, the existence of ethics will provide limits or standards that govern how a nurse behaves. So let's talk about the topic, nursing's ethics. Ethical versus legal. Legal standards are based on written law, while ethical standards are based on human rights and wrongs. Some things can be legal but not ethical. Legal standards are written by government officials, while ethical standards are written by societal norms. Ethical ought to that meaning ought implies in ethics the principle according to which an agent has a moral obligation to perform a certain action only if it is possible for him or her to perform it, and then prudent use of knowledge, of course, and then legal must meaning that legal always suggests an absolute obligation. Ethical principle consists of autonomy, beneficence, non-maleficence, justice, veracity, and fidelity. Autonomy means that ethics are self-governed. Autonomous is derived from two Greek words. First, autos meaning self and nomos meaning law or rule. Right to self-determination treat each individual as an autonomous subject. This term describes as a person's ability to make his or her own rules in life and to make decisions independently. The idea that people must be free to shape their own lives is central to most accounts of autonomy. Next, principle of autonomy that individuals have right to make treatment decisions must have a capacity to make decisions independently, development or consideration, and then health-related challenge. Next, paternalism or parentalism. The points of paternalism are restricting autonomy. One individual assumes the right to make decisions for another and consider it acceptable when patient does not have decision-making capacity. Next, ethic is beneficence and non-maleficence. That meaning we as a nurse have to do good, act in a way that benefits patients, centerpiece of caring, and closely related to non-maleficence. What is good? The meaning of good or do good are do not cause harm, prevent harm, remove harm, more binding than beneficence. Because you're going beyond just trying to do good to that patient, you are trying to prevent harm. Next, justice, treat like case alike. Distributive justice refers to distribution or of benefits and burdens equally disbursed according to need, effort, societal contribution, merit, and legal entitlement. Next, fidelity, duty to faithful to commitments, make a promise, follow through. Includes implicit and explicit promises. Implicit promises that are implicit, not verbally communicate. Explicit promises that are explicitly communicate. And last, veracity, the obligation to tell the truth and do not lie or deceive others, often a source of ethical challenge arising from differences in personal beliefs and unique cultural features. So, conclusion, know yourself and your values. Protect your passion by intervening if you identify an ethical question. Know facility policy for access to the ethics. Commit. Know your responsibilities with regard to informed consent. Respect the patient. Advance directives perfectly. Well, it brings me to the end of my presentation. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.